Hi everyone! Welcome to my YouTube channel, and I'm Kristine, your nursing teacher here in Australia. Now today, we're breaking down the ADPIE process, which is your assessment, diagnosis, planning, intervention, and evaluation in the context of Australian nursing practice. This framework is essential for providing high-quality patient care, but it's also crucial to know when to prioritize life-threatening situations before jumping into the assessment phase. Let's dive in. Assessment is the first and foundational steps in the ADPIE process. This is where you gather all the relevant information about the patient's condition, vital signs, medical history, physical examinations, and patient reports. However, it is crucial to remember that if the patient's airway, breathing, or circulation is compromised, this needs immediate attention before anything else. For example, if a patient is struggling to breathe or has a severely low blood pressure, your immediate intervention, of course, or priority is to stabilize them. In such cases, initiate emergency protocols like provide oxygenation, manage the airway first, or start resuscitation if necessary. Only after the patient is stable, then you should proceed with a full assessment. Now, once the patient is stable and the assessment is complete, the next step is diagnosis. In the Australian nursing context, this means identifying the patient's primary health issues based on the data you've collected. Diagnosis can range from acute problems like an infection to chronic issues such as diabetes management. It's important to use your clinical judgment here, supported by evidence-based practices, to pinpoint what's most important or critical for patients' health. After diagnosing the patient's condition, it's time to move on to planning. This is where you develop a plan to tailor to the patient's specific needs. In Australia, care plans must be comprehensive, often involving a multidisciplinary approach. For example, if your patient has a respiratory issue, your plan might include regular monitoring of oxygen levels, scheduled breathing treatments, and consultation with a respiratory therapist. Setting realistic goals and timeframes is key to ensuring the care plan is effective and achievable. Next comes intervention. This is where the care plan comes to life. As a nurse, you'll be executing strategies that has been laid out in the plan, from administering medications to providing wound care or educating the patient and their family. In Australia, nurses often have a high level of autonomy in carrying out these interventions, which makes it essential to stay informed and up to date with the best practices. Always ensure that each intervention aligns with the patient goals and respect their preferences and cultural needs. The final step in ADPIE is evaluation. This is where you assess the effectiveness of the interventions. Did the patient's conditions improve, or are there any issues that need addressing? Evaluation is a continuous process. If something isn't working, you'll need to reassess and possibly adjust the care plan. In the Australian context, these steps is particularly important as it often involves collaboration with other healthcare professionals to ensure the patients receive the best possible care. To recap, ADPIE is a powerful framework that guides nurses in providing structured and effective patient care. Remember though that if the patient's airway, breathing, or circulation is compromised, those issues take precedence over everything else. Once the patient is stable, you can proceed with the full ADPIE process: assessment, diagnosis, planning, intervention, and evaluation. By following these steps and staying focused on the patient's well-being, you'll be well equipped to handle the demands of nursing in Australia. Now, if you find this video helpful for you, make sure to give us a thumbs up, subscribe to our YouTube channel for more nursing tips and insights, and also leave questions or thoughts in the comments below. Thank you for watching, and we will see you on our next video. Bye for now.